Welcome, everybody. My name is Derek Ritz. I'm a Technical Committee Co-Chair for the Quality Research and Public Health Committee at IHE, and I've got the very light duty of being our moderator. We're going to be hearing presentations from 5 IHE profiles today. The first of these is mRFD. Nicole, oh, there we go. And our presenter is John Stamm, as I hope all of the rest of you can see on the slide. John is an interface developer with EPIC. He is also my technical co-chair for QRPH. He's been involved with IHE for many years. Oh, hold on, there we go. He's been involved with IHE for many years, and I will now yield the floor to John to lead us through an introduction to his profile. Take it away, John.
Thanks, Derek. So as Derek mentioned, my name is John Stamm. I'm a developer at EPIC, and I'm here to talk to you about one of the profiles that's new for the 2017 cycle at IHE QRPH, and that is mRFD, or Mobile Retrieve Form for Data Capture. mRFD is an addition to a family of profiles that allow contextual launch from one application called a filler to another called a manager. Existing profiles in this area include RFD, or Retrieve Form for Data Capture, and SDC, or Structured Data Capture. Both of those profiles focus on well-defined but broad data sets, and they are primarily based around exchanging clinical document architecture, or CDA documents, for the sake of completing forms in the manager system. In this context, forms refers mostly to data entry fields, some of which contain data that needs to come from the filler system, and some of which may require manual entry because they require data that doesn't currently exist in either the filler or the manager system. mRFD is an IHE profiling of the Smart On Fire EHR launch. That means that it's an organized set of steps to launch a Fire-based web application from within a host system. Instead of exchanging a SOAP-based block of information like RFD and SDC do, it exchanges enough context to allow Fire-based queries of the application database on the filler side. It is a secure exchange that includes capability statements from the Fire resource servers. And the resources themselves are not profiled here and can be customized to meet the needs of a given application. When thinking about why this is a useful profile, we can envision ourselves as an application developer who's working on genetic visualizations for providers to share with patients. We know that we need standards-based support from EHR systems for the data, and we need the information to be secure and real-time. Once we've selected Fire to meet those needs, though, another set of needs emerge. We also want this information to involve a seamless launch for providers from their existing workflows. We want to maintain user context as far as what patient is being looked at and as far as any user preferences that the user has provided. And we want to maintain security and auditing because we expect protected health information to be exchanged as part of this workflow. mRFD and Smart On Fire provide secure solutions through technologies like OAuth 2. The browser from the provider side is directed to authorize the exchange of data between the application and the EHR. After an exchange of access tokens, Fire resources may flow to drive the visualization. On the value side, technology folks should be excited because this allows a secure, auditable, scalable, and extensible solution that they can use with a variety of different applications to be able to launch their same web app and be able to pull in the data that they're looking for. On the marketing side, the value here is around it being a standards-based solution, not just from the Fire exchange point of view, but now also from the launch point of view, as well as allowing a seamless workflow for those providers that they don't have to navigate to any extra applications in order to get the value out of that app. If you're interested in mRFD, I hope that you sign up for Connectathon 2018 to give it a try. And with that, I can turn it back over to Derek.
John, thank you. You have been a model and an example for every other presenter to stay within their 5 minutes, and I very much appreciate that. And I would like to open the lines if folks have got questions for you.
Hi, John. It's Alex from Cancer Care Ontario. I have a pretty specific question about how you envision testing mRFD. I'm wondering if you're planning on testing it with some of the other profiles you mentioned, such as RFD and SDC, at the connectathon, I mean.
So primarily mRFD is going to function as a way of launching off on testing the other IHE profiles that are FHIR-based exchanges. The last exchange in our mRFD is currently put in place just to be a very generic hopping off point to allow you to sort of exchange other data. Most folks that I'm aware of that are looking to sort of upgrade or change from what they're currently doing with RFD or SDC to an mRFD type approach are going to primarily get the same uses that they had before out of parsing CDA documents and exchanging the CDAs during a FHIR exchange. There isn't really a particular or set method to sort of go from regular RFD or regular SDC in one workflow over to mRFD.
Okay. Are there plans to add that in later then, or?
So I'd be interested in hearing what you have in mind as far as the ways to sort of merge those. All three profiles sort of focus around the same use case as far as a provider on the manager side needing to be, on the filler side, needing to be able to fill out a form and launch that information from the manager. And so those sort of initial steps really only occur once in any of the profiles. Right.
Okay. I think this is a bigger discussion than just the 5 minutes for questions.
I was just going to say that it sounds like Alex, that you'll want to exchange details if you don't already have them with John and be able to explore that further. I'm sure that all of you join me in thanking John for an excellent presentation, and we'll move along to the next of our presentations.